Hi, I'm Dr. Harston, and welcome to Medical Minute with Norton Healthcare. One question that I commonly hear from patients is how painful is ankle replacement surgery? First, ankle replacement surgery is indicated for patients with severe arthritis pain. This could be as a result of osteoarthritis, rheumatoid arthritis, or sometimes a past injury to the joint. Ankle replacement surgery is a major surgery which can be quite painful. Pain is managed through several methods, including a nerve-numbing shot called a nerve block, which can keep the leg numb for 2 to 3 days, oral pain medicines, a splint to hold the ankle still, and a requirement to keep pressure off of the foot initially. Following your doctor's instructions about rehabilitation, wound care, and medications will increase your chances for a positive outcome from the operation. It is important to remember that every patient and diagnosis is different. If you have questions about your specific conditions, I recommend you talk to an orthopedic provider about a treatment plan that is right for you. For more information or to schedule an appointment with a provider, visit nortonorthopedics.com.